Welcome to the deep dive. We are absolutely thrilled you're joining us today.
Yeah, we've got a really fascinating one lined up for you.
We really do. I want you to sit back and, picture a scenario for a moment. Imagine a globally recognized medical solution,
Right.
a chemical compound that has, without hyperbole, completely revolutionized the lives of millions of people around the world.
Absolutely changed the game.
It has. It's a molecule that has saved marriages, restored confidence, and changed how we fundamentally understand the mechanics of the human body.
Hmm.
Now, I want you to imagine taking that precise, miraculous chemical, ripping it out of the heavily guarded, rigorously inspected laboratories of traditional Western medicine.
And just tossing it into the wild.
Exactly, dropping it squarely into the absolute wild west of internet pharmacies, porous international borders, and shadowy global shipping networks.
It sounds like the setup for a thriller, but I mean, it's happening every single day.
Every single day. And it begs so many questions. What happens to patient safety when you do that?
That's the big one.
What happens to the fundamental guarantee of what you're actually putting into your own body? And perhaps most importantly, and this is what we really want to get into today, why are so many people, maybe even people, willing to take that massive leap of faith?
That is the core of the mystery, isn't it?
Yeah.
It's a fascinating collision of human psychology, global economics, and, well, basic biochemistry.
Yeah.
When people are desperately seeking solutions for highly personal, incredibly sensitive health issues, the raw appeal of cheap, easy accessibility often goes head-to-head with the invisible but completely crucial safety nets of medical regulation.
Right, because people want to fix.
They want to fix, and they don't always care about the red tape standing in front of it.
Today, we have a massive stack of sources on the table to help us navigate this exact collision. We're looking at comprehensive medical prescribing information, incredibly detailed safety warnings, and a truly fascinating thread of real, unfiltered user reviews.
Which are so revealing.
They are. And we sourced all of this directly from the iMedix medical content engine, the subject at the center of all this documentation, a drug called Kamagra.
Which is a medication that has become an absolute international phenomenon.
It really has.
And it's achieved that status despite occupying a very gray and often totally illicit area of the global pharmaceutical market.
So our goal today is to cut through the noise. We are going to look at the hard science of the molecule, the harsh regulatory realities of the global market, and the deeply human behaviors that are driving the demand for this specific product.
It's a lot to cover.
It is. The mission for our deep dive today is essentially threefold. First, we want to explore the actual fundamental science behind sildenafil.
Which is the active ingredient.
Exactly. We need to understand what it actually does inside the human body. Second, we're going to dissect exactly why Kamagra specifically has become such a massive, internationally sought-after product.
Yeah.
And third, we are going to navigate the incredibly murky, often highly dangerous waters of unregulated online medicine. Okay, let's unpack this.
Let's do it.
Let's start with the absolute foundation. If someone hands you a packet that says Kamagra on it, what actually is it, and how does it supposedly work?
Well, let's start with the hard data from the iMedix documentation. At its core, Kamagra is a pharmaceutical product manufactured by a company called Ajanta Pharma Ltd.
And they are based where?
They're based in India. It is medically indicated for the treatment of erectile dysfunction, or ED, in adult males. The active pharmaceutical ingredient, the actual chemical doing the heavy lifting here, is a compound called sildenafil citrate.
Sildenafil citrate. Now, I'm guessing that name sounds incredibly familiar to a lot of people listening to this.
Oh, it definitely should. It is the exact same active ingredient found in the immensely famous, globally recognized brand name drug, Viagra.
So it's essentially the same engine just dropped into a completely different car.
That is a perfect way to look at it. The text classifies this specific chemical engine as a phosphodiesterase type 5 inhibitor, or, for short, a PDE5 inhibitor.
All right, I'm going to stop you right there because my eyes just glazed over.
Fair enough.
Phosphodiesterase type 5 inhibitor. For those of us listening who do not have a PhD in advanced pharmacology, how does a PDE5 inhibitor actually function when it enters the human body? What is it inhibiting?
It's a great question. And to truly understand how sildenafil works, we actually have to take a step back.
Okay.
We have to understand the natural baseline physiology of an erection. It is not just a simple mechanical switch.
Right.
It is a highly complex process that relies heavily on a very specific chemical cascade happening in real time.
So walk us through that cascade. What happens first?
It all starts in the brain. When a man experiences sexual arousal, the nervous system sends a signal down to the erectile tissue of the penis.
Specifically an area called the corpus cavernosum, right?
Exactly, the corpus cavernosum. This signal prompts the local tissue to release a signaling molecule called nitric oxide.
Nitric oxide. Okay, so I like to think of this like a massive biological plumbing system or maybe a traffic light system.
I like the plumbing analogy.
Right, so the arousal on the brain is the green light. The nitric oxide is the starting pistol sending the signal down the line. What does the nitric oxide do once it's released?
That starting pistol fires, and the nitric oxide directly triggers the production of a completely different chemical.
Mm.
It's a nucleotide called cyclic guanosine monophosphate.
That's a mouthful.
It is, so we can just call it CGMP. Now, CGMP is the absolute hero of this entire biological story.
What makes CGMP so important?
Its specific, vital job is to relax the smooth muscle cells located inside the walls of the blood vessels in the penis.
Okay.
Normally, those blood vessels are somewhat constricted, but when CGMP floods the area, those smooth muscles relax and the blood vessels dilate. They open up incredibly wide.
Letting the blood in.
Exactly. This allows a massive, rapid inflow of blood into the spongy tissue.
Yep.
That rapid inflow and the subsequent trapping of that pressurized blood is what physically creates the erection.
Okay, following the plumbing analogy, the CGMP is the valve. The valve opens up the pipes expand, and it lets the water, or in this case, the blood flow in at high pressure.
Spot on.
That all makes perfect sense. But you called sildenafil a PDE5 inhibitor. Where does PDE5 come into this plumbing system?
Well, the body is a highly efficient machine,
Yep.
and it naturally wants to return to a baseline state.
Mm-hmm.
It doesn't want those valves open forever.
Right.
So the body has a built-in regulatory system like a cleanup crew. That cleanup crew is an enzyme called phosphodiesterase type 5 PDE5.
So PDE5's job is to shut the system down.
Its sole dedicated purpose in this specific tissue is to hunt down, break apart, and destroy the CGMP. Is the biological off switch.
Wow.
As PDE5 destroys the CGMP, the smooth muscles stop relaxing. The blood vessels constrict back to their normal narrow size. The blood flow stops, the trapped blood drains out, and the erection subsides.
It's the ultimate biological buzzkill. It just comes in and turns the valves off.
It really is. And that is exactly where the genius of sildenafil comes into play. Sildenafil is a PDE5 inhibitor.
Ah, okay.
When you take this drug, the molecule travels through the bloodstream, finds that PDE5 enzyme, binds to it, and essentially puts it in a temporary chokehold. It physically stops the enzyme from doing its job.
So it's not magically creating an erection out of thin air. It's just blocking the cleanup crew from doing their job.
Precisely. By blocking the enzyme that destroys CGMP, sildenafil allows the CGMP levels to remain artificially high in that local tissue.
Because they aren't being broken down.
Right. Because the CGMP is still hanging around, the smooth muscles stay relaxed, the blood vessels stay dilated, and the blood flow is maintained. It simply prevents the body from prematurely turning off the physiological mechanism that sustains the physical state.
That is actually incredibly elegant biochemistry. It's not forcing a bizarre, unnatural reaction on the body. It's just temporarily disabling the off switch.
Exactly. It's brilliant.
But reading through the prescribing information we have here, there is a very, very crucial caveat. And I think this is probably one of the biggest pop culture misconceptions about drugs like Kamagra and Viagra.
Oh, definitely.
The text explicitly states that sildenafil is not an aphrodisiac.
That is a fundamental, non-negotiable point raised in all the medical guidelines we're looking at. Sildenafil strictly addresses the mechanical, physiological component of blood flow. It requires sexual stimulation to initiate that entire chemical cascade we just talked about.
Because if you don't have the arousal, you don't have the starting pistol.
Exactly. If there is no sexual arousal, the brain never sends the signal. Therefore, there is no nitric oxide released into the tissue.
Right.
If there is no nitric oxide, there is absolutely zero CGMP produced. And if there is no CGMP in the tissue, it does not matter how much sildenafil you take.
It won't do anything.
It doesn't matter how much you inhibit the PDE5 enzyme, because there is no CGMP to protect in the first place. Nothing will happen. The drug cannot create desire. It can only facilitate the body's physical response to pre-existing desire.
Which means, when you really get down to it, it is treating a symptom, the lack of mechanical blood flow. It is not necessarily treating the root cause of why the person has erectile dysfunction, right?
That is a critical distinction that medical professionals try to hammer home.
Yeah.
Erectile dysfunction is very rarely just a standalone issue. It's usually a symptom of a deeper etiology.
What kind of underlying issues are we talking about?
Well, it could be vascular, meaning There is severe plaque buildup or damage to the blood vessels themselves throughout the body, preventing adequate flow regardless of the chemical signals.
Okay.
It could be neurological, stemming from nerve damage due to uncontrolled diabetes or spinal cord injuries or even prostate surgery. It could be hormonal, like severe testosterone deficiency,
Or psychological, I imagine.
deeply psychological stress, anxiety, depression, or very often it is a highly complex, interwoven combination of all of these factors.
So sildenafil basically bypasses whatever the root cause is and just forces that final mechanical step in the pathway to work by ensuring the blood vessels stay dilated.
It does, and this is exactly why the prescribing information so heavily stresses that a comprehensive medical assessment is absolutely required before a patient starts therapy.
That makes sense.
A doctor needs to know why the ED is happening in the first place, because it could be the first warning sign of a major silent killer, like cardiovascular disease.
It's like putting a bucket under a leaky roof in your living room. The bucket catches the water, and it solves the immediate frustrating problem of your expensive hardwood floor getting wet. But the bucket does absolutely nothing to fix the gaping hole in your roof.
That's a great analogy. The bucket is necessary for your quality of life right now,
Yeah,
but you still need a roofer to inspect the house.
exactly. Now let's pivot from the molecule itself to the actual product we are examining today. Because while sildenafil is a widely understood, highly studied, and fully approved molecule in many forms across the globe, Kamagra specifically occupies a very unique, highly controversial space in the global pharmaceutical market.
It really does. As the iMedix documents clearly outline, Kamagra is manufactured by Ajanta Pharma in India. And while it is legally marketed and sold in several countries around the world, it is notably, glaringly not approved by the major Western regulatory bodies.
Not at all.
The United States Food and Drug Administration,
Mhm.
the FDA, has not approved it. The European Medicines Agency, the EMA, has not approved it. It is also completely unapproved by the health authorities in Canada and the United Kingdom.
Yet, despite not having the green light from the FDA or the EMA or Health Canada, Kamagra is absolutely everywhere. It is a massive, sprawling global phenomenon. And one of the things that I found most bizarre and interesting in the source material is the sheer variety of forms it comes in. It's not just a standard clinical white pill in a blister pack.
No, the marketing and formulation are highly diversified. The documentation does list standard oral tablets, which typically come in 50 milligram and 100 milligram doses, but it also comes in effervescent tablets, the kind you drop into a glass of water and watch fizz up.
Okay.
And most notably, it is sold and heavily marketed as an oral jelly, which also contains a massive 100 milligram dose of sildenafil.
An oral jelly. I have to admit, I stared at that part of the document for a long time.
Surprising, isn't it?
It really is. Why on earth would a pharmaceutical company manufacture a heavy-duty, potent cardiovascular medication in the form of a fruit-flavored jelly? I mean, trying to be objective, there are obvious practical reasons. Some patients suffer from dysphagia, they have a genuine physical difficulty or phobia regarding swallowing solid pills. For someone in that situation, a jelly or a dissolvable tablet is actually a huge medical benefit.
What's fascinating here is how the formulation itself radically changes the risk profile of the entire drug.
How so?
Yes, from a pure marketing or user experience standpoint, the oral jelly elegantly addresses the issue of pill aversion. But if you look closely at the iMedix safety warnings, they explicitly, repeatedly call out these alternative forms as a massive area of concern.
Okay.
When you take a highly potent medication, one that can cause profound systemic physiological changes, massive drops in blood pressure, and you intentionally package it as a brightly colored, artificially fruit-flavored, easily consumable jelly,
You're asking for trouble.
you are introducing severe compounding risks.
I assume the primary risk being accidental ingestion by someone who has no business taking a PDE5 inhibitor.
Exactly. The text warns, in no uncertain terms, that these flavored or jelly formulations can incredibly easily be mistaken for candy or a children's snack.
Oh, wow.
Imagine a child finding a brightly colored strawberry-flavored packet of Kamagra oral jelly in a drawer or a bag and consuming it. A 100 milligram dose of sildenafil in a small child's body would cause catastrophic vasodilation, a terrifying plunge in blood pressure, and potential cardiovascular collapse.
That is a horrifying scenario. It takes a drug meant to be kept safely in a medicine cabinet and turns it into an attractive nuisance. And the text mentions another issue with the jelly that I hadn't even considered, the manufacturing stability.
Right. The safety documentation raises serious alarms about the sterility and the chemical stability of non-tablet forms. Think about it. A solid, compressed dry pill is relatively highly stable. It can handle minor temperature fluctuations. But a liquid or a semi-solid jelly formulation is a completely different beast. It requires vastly different, highly complex preservatives and strict manufacturing controls to ensure the active chemical doesn't degrade over time.
Or get contaminated.
Right. Or worse, that the wet environment doesn't begin to harbor bacterial or fungal growth.
Especially considering how this stuff is shipped. It's not moving in climate-controlled, medical-grade transport. It's sitting in the back of cargo planes, baking in unair-conditioned delivery trucks, crossing international borders without any temperature monitoring whatsoever.
Which means by the time that jelly reaches the consumer, the chemical composition could be entirely compromised.
It paints a very vivid picture of the dual-edged sword of accessibility, doesn't it?
It really does.
On one hand, you have a product that appeals massively to consumers because it offers variety. It perhaps offers a lower price point. And it offers formats that feel distinctly less clinical. Taking a fruit-flavored jelly probably feels a lot more like a lifestyle choice or a supplement than swallowing a sterile white pill for a medical condition.
Definitely.
But on the other hand, to get that convenience, you are stepping completely and entirely outside the boundaries of any regulatory oversight. And that brings us to what I think is the most important topic in our sources, the massive, yawning chasm between FDA approval and the unregulated Wild West of the internet.
It is a critical, life-saving distinction that the iMedix documentation emphasizes repeatedly. We have established that the active ingredient in Kamagra, sildenafil citrate, is the exact same molecule found in FDA-approved generics.
Right.
But the final packaged product called Kamagra is not FDA-approved. And people often brush that off as just bureaucratic red tape. But it isn't just paperwork. FDA or EMA oversight provides a very specific ironclad set of guarantees to the consumer that you simply do not get anywhere else.
Let's actually break those guarantees down, because I think we take them for granted. If you, the listener, go to your local regulated pharmacy right now and pick up a prescription for generic sildenafil, what has that manufacturer actually had to prove to the government to get that pill into your hands?
It is an incredibly arduous process. To legally sell a generic drug in the United States, the manufacturer must submit an abbreviated new drug application, known as an ANDA.
Okay.
Through this highly scrutinized process, they must scientifically, undeniably prove bioequivalence to the original brand name drug.
Bioequivalence, meaning it doesn't just have the same ingredient, it behaves the same way.
Exactly. They have to run clinical trials to demonstrate that their specific generic pill delivers the exact same amount of the active ingredient into the human bloodstream at the exact same rate of absorption and the exact same rate of clearance as the original multi-billion-dollar drug.
So a 100 milligram generic pill from a pharmacy has been proven to act identically in your body to a 100 milligram brand name pill.
Yes, but it goes further than that. The manufacturer must also adhere strictly 24/7 to U.S. Good Manufacturing Practices, or GMP. This is where the real oversight happens.
What does that entail?
This involves rigorous, regular, unannounced, independent inspections of their physical manufacturing facilities by government agents.
We're actually walking the factory floor.
They are auditing everything. The FDA verifies the exact quantity and chemical purity of the raw active ingredient. They verify the safety and the quality of all the inactive ingredients, known as excipients.
Wait, let's define excipients. What are those?
Excipients are all the other things that make up the pill. The binders that hold the powder together, the fillers that give it bulk, the chemical dyes used to color it, the coatings that make it easy to swallow.
Okay.
The FDA ensures none of those are toxic. They ensure the entire manufacturing line is sterile. They run stress tests to verify that the expiration dates printed on the box are perfectly scientifically accurate.
Okay, so that is the gold standard. That is what you are paying for when you go through the official healthcare system. And when you decide to bypass that system, when you go online and buy Kamagra, a drug manufactured exclusively for foreign markets and actively dodging FDA or EMA oversight, you instantly lose every single one of those independent guarantees.
You do.
You're relying 100% on the honor system of a manufacturer thousands of miles away that you have never met.
The sources explicitly state that drugs not subject to FDA oversight simply do not carry the same assurances. Period. You have no guarantee regarding manufacturing quality, ingredient purity, dosage accuracy, or basic safety. You are flying completely blind.
Which means the dosing could be completely wild.
Exactly. The 100 milligram tablet you take from an unregulated source might indeed have 100 milligrams of sildenafil, but it might have 50 milligrams, leaving you frustrated that it didn't work.
Or worse.
Far more terrifyingly, due to a sloppy mixture on the factory floor, it might have 150 or 200 milligrams in a single pill. Taking a massive accidental overdose drastically increases the risk of severe, life-threatening side effects. And there is absolutely no independent authority verifying what is actually in that packet.
And the sources tell us it gets even darker than just an honest mistake with inconsistent dosing. Because Kamagra is not legally marketed in places like the US or the UK, people who want it can't just walk into a reputable pharmacy and ask for it. They are forced to turn to the internet.
Yeah.
And the safety warnings in our iMedix sources highlight the terrifying realities of the illicit online pharmacy ecosystem.
The documentation points out that the primary, almost exclusive channel for obtaining Kamagra in unapproved regions is through unregulated, shadowy online sources. And these distribution networks are notoriously predictably dangerous. The text explicitly, strongly warns about the massive risk of counterfeit products.
This is the part that blows my mind. We aren't just talking about a gray market import of a real drug. We are talking about complete fakes.
Exactly. When you hand over your credit card to an illicit website, you have zero guarantee that the drug arriving in your mailbox was actually manufactured by a Hanta Pharma in their Indian facilities.
Right.
You could very well be buying a total counterfeit pressed together in an unregulated, filthy, unsanitary basement laboratory somewhere.
The specific details in the text regarding what investigators have found in these counterfeits are incredibly concerning. They mention that counterfeit pills may contain absolutely zero active ingredients.
Just a placebo.
In that scenario, you're just taking a talk placebo and wasting your money. But it's the other end of the spectrum that is horrifying. They mention these pills could be contaminated with heavy metals.
Yeah.
The idea that someone could be unknowingly ingesting lead or arsenic while trying to privately treat an intimate medical condition is deeply, profoundly alarming.
It is a severe public health crisis. The sources also mention contamination with other undeclared, totally unrelated pharmaceuticals.
Why would they put other drugs in there?
To mimic the effects of the real drug, or just due to cross-contamination on duty equipment. A counterfeit pill might contain a little bit of sildenafil, but it might also be cut with cheaper, highly dangerous, unregulated stimulants, or blood pressure medications, or other active compounds that the consumer has absolutely no idea they are ingesting.
That's insane.
There's no regulated chain of custody. From the moment the raw chemicals are synthesized in an uninspected vat to the moment the sketchy package arrives at your front door, there is absolutely zero oversight ensuring your safety.
This entire section of the research raises a massive, unavoidable question for you, the listener. You have to step back and ask yourself, why would any rational human being willingly take that level of risk?
It's a great question.
Why risk heavy metals and counterfeits? And the answer clearly points to the intense, fundamental human desire for intimacy and connection. That desire is being coupled with the high financial cost or perhaps the deep personal embarrassment of navigating the traditional clinical healthcare system.
It's a perfect storm. People want a quick, affordable, totally private solution to a problem that causes them immense psychological distress. But the devastating trade-off is that, in seeking that privacy, they are stepping blindly into a shadowy supply chain where basic quality control is virtually non-existent.
It really highlights a massive friction point in modern healthcare. The regulatory walls, the FDA, the EMA, the ANDA process, those walls are built with the express purpose of keeping people safe from heavy metals and lethal, incorrect dosages.
Right.
But when those protective walls inadvertently make the life-changing medication too expensive or too embarrassing or too difficult to obtain, a parallel, highly illicit market will inevitably spring up to meet that desperate demand, dragging all those severe, life-threatening risks right along with it.
It is the ultimate catch-22 of medical regulation.
Speaking of severe risks, let's set aside the counterfeit issue for a moment. Let's assume you somehow get a perfectly pure, accurately dosed 100 milligram pill of pure sildenafil. Let's look at what the actual verified molecule does to the body. Because while sildenafil is highly effective at what it does, it is absolutely not without its side effects. Our sources have a very, very detailed breakdown of the adverse reactions, and reading through this list, it really hits home just how aggressively powerful this medication is.
The iMedix clinical guide points out a fundamental, inescapable truth about sildenafil's side effect profile. They are generally highly dose-dependent, and they are almost entirely the direct, logical result of the drug's primary mechanism of action.
Which is vasodilation.
Correct. Vasodilation. Almost all the common adverse reactions you read about on the warning label are simply the result of your blood vessels opening up extremely wide in places where you might not necessarily want them to open up.
Right, because it's a systemic drug. You take the pill orally, it goes into your stomach, it's absorbed into your systemic bloodstream, and it travels absolutely everywhere in your body.
It doesn't discriminate.
It doesn't just politely target the specific anatomical area you want it to. It goes to your brain, your lungs, your skin. So let's walk through the body based on the clinical notes provided. The most common side effects listed are headache, flushing, dyspepsia, which is medical jargon for indigestion and nasal congestion.
Yes.
Now, I get the headache and the flushing. If your blood vessels dilate, blood rushes everywhere. But nasal congestion. The text specifically lists a stuffy nose as a common side effect. Are people catching a sudden cold from this pill?
It absolutely feels like a sudden head cold, but it has nothing to do with a virus or mucus. It is a direct mechanical vascular response. The mucosal lining of your nasal passages is incredibly densely vascular. It is packed with tiny blood vessels.
Oh, I see.
When sildenafil enters the bloodstream, those tiny blood vessels in your nose dilate, just like the ones everywhere else. When they dilate, the tissue physically swells up, restricting the airway and making you feel totally congested. You can't breathe through your nose, not because of mucus, but because your nasal tissue is literally swollen with blood.
That is fascinating and incredibly annoying. And what about the dyspepsia, the heartburn? Why does an ED drug give you indigestion?
Again, it comes back to the smooth muscle relaxation. We talked about how sildenafil relaxes smooth muscle and blood vessels. Well, you also have a ring of smooth muscle at the bottom of your esophagus, called the lower esophageal sphincter.
Okay.
It acts as a trapdoor to keep stomach acid in the stomach. Sildenafil can inadvertently relax that smooth muscle, too. When that sphincter relaxes and gets loose, stomach acid can creep back up into the esophagus, causing the painful burning sensation of heartburn or indigestion.
Okay, so a headache, a red face, a stuffy nose, and heartburn. Those are the common, usually mild and transient effects. But the sources also list uncommon and rare side effects, and honestly, this is where the biology gets weirdly fascinating.
It really does.
They mention dizziness, hypotension, which is a dangerous drop in overall blood pressure, myalgia, or severe muscle pain, and visual disturbances. And the text gets very specific here. It mentions a color tinge to a patient's vision. Now, I have to ask, why in the world would a drug designed to alter blood flow for erectile dysfunction make a patient suddenly see the world in different colors?
This is a classic textbook example of how medications can have unintended off-target effects because the human body reuses the same biological tools in different places. We spent a lot of time discussing how sildenafil specifically targets and inhibits the PDE5 enzyme. Well, the human body has a whole family of different phosphodiesterase enzymes. One of those cousins is called PDE6.
And where does PDE6 live?
PDE6 is located almost exclusively in the retina of the human eye. Its specific job is crucial for how our photoreceptors process light and allow us to see color. Now, sildenafil is highly chemically selective for PDE5, but it is not perfect. It does have a mild, unintended inhibitory effect on PDE6 as well. When that PDE6 enzyme in your eye is temporarily inhibited by the drug, it alters how the retina processes light waves, very frequently resulting in a temporary, pervasive blue or green tinge to the user's entire field of vision.
That is absolutely wild. Think about that for a second. You swallow a pill to alter the blood flow in one specific part of your body, and because the chemical structure of your enzymes is similar, it ends up literally tweaking the chemistry of your retinas so you see a blue world.
It's incredible.
It just shows how interconnected the body really is. But while a blue tinge to your vision might be weird or unsettling, the sources outline some serious, terrifying emergencies that require immediate, drop-everything medical attention.
Yes, the safety warnings are totally unequivocal about these rare but severe events. The first and most famous is priapism, which is clinically defined as a painful erection lasting longer than 4 hours.
We've all heard the rushed warnings at the end of the television commercials, and it almost sounds like a joke. But the text emphasizes that this is a true, severe urological emergency. Why is 4 hours the danger zone?
Because it becomes an issue of oxygen starvation. We talked about how blood rushes in and gets trapped to create the erection. Well, if that blood remains trapped in the corpus cavernosum for an extended period, The local tissue consumes all the oxygen in that blood.
Right.
The blood becomes completely deoxygenated and toxic. This leads to a state called severe tissue ischemia.
Ischemia meaning the tissue is suffocating.
Exactly. The cells literally begin to suffocate and die. If it goes on too long, it leads to permanent, irreversible cellular death and the formation of scar tissue, which can permanently destroy the patient's natural erectile function forever. It is not a joke. It must be treated immediately, which usually involves a doctor physically draining the trapped, deoxygenated blood with a needle in an emergency room setting.
The text also warns of a sudden loss of vision in one or both eyes and a sudden decrease or complete loss of hearing.
The vision loss is a particularly terrifying risk. It is often linked to a rare condition called non-arteritic anterior ischemic optic neuropathy, or NAION.
What exactly happens there?
Essentially, the massive systemic drop in blood pressure caused by the sildenafil can critically compromise the vital blood supply to the optic nerve in susceptible individuals. Without that blood supply, the optic nerve suffers a stroke, leading to sudden, irreversible, permanent vision loss. The sudden hearing loss is believed to be related to similar severe vascular changes or pressure drops in the delicate structures of the inner ear. Both of these events require the patient to immediately stop taking the drug and seek emergency medical evaluation.
And then there is the sheer cardiovascular workload. The text points out something very practical but easily overlooked. Sexual activity is a form of intense physical exertion. It drastically increases cardiac output and heart rate.
And this is exactly why the initial professional medical evaluation is so utterly critical. If a patient has unstable angina, severe heart failure, or has recently suffered a myocardial infarction, a heart attack, or a stroke, their cardiovascular system is already highly compromised. It may simply not be strong enough to handle the intense physical exertion.
That makes sense.
Furthermore, sildenafil inherently causes a systemic transient decrease in overall blood pressure. If you combine an artificial drop in blood pressure with the massively increased physical demand on an already weakened heart, the results can be instantly fatal. The drug is strictly contraindicated for any man for whom sexual activity is deemed medically unsafe by their physician.
It really puts into stark perspective just how powerful this tiny molecule is. And while everything we just listed sounds incredibly scary, it is important to remember that, as the text notes, these side effects are largely dose-dependent. Which brings up a very interesting detail in the dosing guidelines regarding older patients.
Yes, the prescribing information explicitly recommends that elderly patients, clinically defined as those 65 years of age and older, should generally be started at a significantly lower dose of 25 milligrams rather than the standard 50, and they should be under close medical supervision.
Why is that? Is it just because they are older and frailer?
It's much more specific than that. It has to do with how their organs process chemicals. As we age, our hepatic and renal function, the efficiency of our liver and our kidneys, often naturally slows down.
Okay.
This means older patients have significantly altered drug clearance rates. Their liver doesn't break the drug down as fast, and their kidneys don't filter out as fast. Therefore, the medication stays active in their systemic circulation much longer, and it accumulates at much higher plasma concentrations.
So it builds up.
Right. A 50 milligram dose in a 70-year-old might act like a 100 milligram dose in a 30-year-old. They also naturally have a much higher likelihood of pre-existing comorbid cardiovascular conditions. Starting them at a low 25 milligram dose helps the doctor cautiously assess their tolerability and vastly minimizes the risk of severe adverse events.
Okay, we've talked extensively about what sildenafil does to the body all by itself. Here's where it gets really interesting. Let's look at what happens when sildenafil interacts with other outside substances. Because the interactions section of our source document is incredibly detailed, and it outlines some chemical combinations that range from mildly counterproductive to literally immediately life-threatening.
The most critical warning in the entire clinical document, a warning that is highlighted in bold text and strictly labeled as an absolute contraindication, is the deadly interaction between sildenafil and any form of nitrates.
Let's clearly define what nitrates are so everyone understands.
Yeah.
These are common prescription medications like nitroglycerin, which is used constantly to treat chest pain or angina, right?
Yeah.
And the text also very specifically mentions recreational drugs like amyl nitrite, which are commonly known on the street as poppers. What exactly happens inside the body when you mix sildenafil with the nitrate?
It creates a massive, uncontrolled, violently synergistic effect on the vascular system. We have to look at what both chemicals are trying to do. Nitrates actively donate nitric oxide to the body. aggressively forcing blood vessels to open up and dilate to relieve chest pain. Sildenafil, as we now know, forcefully prevents the body from closing those blood vessels back up.
Right.
When you combine them, you trigger a state of profound, life-threatening hypotension. The blood vessels open so wide and are prevented from closing that the systemic blood pressure crashes so fast and so far that the heart and the brain are instantly deprived of oxygen. The text warns, in stark medical terms, that this can lead directly to myocardial infarction, stroke, or sudden cardiac death.
The warning here is so stark. The text says concurrent use is strictly, under all circumstances, prohibited. And it gives a very specific, terrifying, real-world emergency scenario. If a patient is experiencing severe chest pain and the paramedics arrive at their house, it is absolutely critical, life-saving information that they are told if the patient has taken sildenafil within the last 24 to 48 hours.
That simple piece of communication to the paramedic is entirely a matter of life and death. The absolute standard emergency medical protocol for treating acute chest pain often involved immediately administering sublingual nitroglycerin.
Wow.
If the paramedics don't know the patient has a PDE5 inhibitor still active in their system, the very treatment that is meant to save their struggling heart could be the exact trigger that causes an irreversible fatal crash in their blood pressure.
That is a terrifying scenario to imagine. And again, it perfectly highlights the severe hidden danger of acquiring these drugs without the oversight of a medical professional. A doctor writing a prescription for sildenafil will drill that nitrate warning into a patient's head until they memorize it. Someone buying Kamagra oral jelly from a sketchy illicit website might never even read that warning, or they might not realize that their recreational poppers are a deadly chemical match.
Exactly.
But nitrates aren't the only blood pressure medications that have dangerous interactions, right? The text also points to alpha blockers.
Yes, it does. Alpha-adrenergic blocking agents such as tamsulosin or doxazosin are extremely commonly prescribed medications. They are used daily by millions of men for hypertension or for managing benign prostatic hyperplasia, which is an enlarged prostate. These drugs also work to lower blood pressure by chemically relaxing the muscle tone in the walls of the blood vessels.
Okay.
The iMedix guidelines issue a strong warning that co-administration of Kamagra with an alpha blocker can lead to severe additive hypotensive effects, resulting in symptomatic postural hypotension.
Let's translate that jargon. Postural hypotension. That's that feeling when you are sitting down, you stand up too fast, and you suddenly feel incredibly dizzy, lightheaded, or your vision goes black because your blood pressure drops too rapidly to pump blood up to your brain, right?
The guidelines clearly state that if a patient medically requires both therapies, Kamagra should never be introduced until the patient is completely hemodynamically stable on their alpha blocker regimen.
Wait, let's translate hemodynamically stable for a second. We're essentially saying the patient's overall blood pressure needs to have leveled out and found its consistent, normal baseline on their regular daily medication before a doctor would even think about throwing Kamagra into the mix to complicate things.
Exactly. You don't want two different drugs fighting to lower the blood pressure at the same time if the patient isn't already perfectly stable. And even then, it should only be initiated at the absolute lowest possible dose of 25 milligrams to test the waters.
Now, let's look at how the body actually clears this drug out of the system. Because there is a truly bizarre but completely chemically logical interaction mentioned in the text involving something called the CYP3A4 isoenzyme.
This is a fascinating bit of pharmacokinetics. Once sildenafil has done its job, it needs to be metabolized or broken down and removed from the body. This happens in the liver, and the heavy lifting is done primarily by a specific liver enzyme called cytochrome P450-3A4, or CYP3A4 for short.
Okay.
If you introduce an outside substance into the body that actively inhibits or blocks that specific liver enzyme, the liver suddenly loses its ability to process and eliminate the sildenafil.
And the sources list some known potent CYP3A4 inhibitors.
Yeah.
They mention heavy prescription drugs like ketoconazole, which is a strong antifungal, ritonavir, which is a powerful antiviral used in HIV treatment, and clarithromycin, a common antibiotic. But the one that always catches people completely off guard is a simple, everyday grocery store item, grapefruit juice.
It is the absolute classic pharmacokinetic interaction taught in every medical school. Grapefruit juice naturally contains complex organic compounds called furanocoumarins. These compounds actively and aggressively inhibit the CYP3A4 enzyme in both your intestinal tract and your liver.
Think about how wild that is for you listening right now. You have this incredibly complex, highly engineered chemical compound in a pill, and its entire, carefully studied safety profile can be completely derailed by what you decided to drink with your breakfast. It completely shatters the illusion that taking a pill is an isolated event in your body.
It really does. If you drink a glass of grapefruit juice while taking sildenafil, your body fundamentally loses its ability to clear the drug efficiently. The text notes this can cause sildenafil plasma concentrations in your blood to spike significantly. A normal, safe 50 milligram dose could suddenly behave inside your body like a massive, dangerous 150 milligram overdose.
That's terrifying.
That severely raises your immediate risk for all those terrible adverse effects we just discussed, the profound hypotension, the visual disturbances, the priapism, all from a glass of juice.
That is just amazing to me. And speaking of very common beverages, we have to talk about alcohol, because this is a massive area of public misconception. I think it is incredibly safe to assume that a vast number of people taking ED medication might combine it with alcohol, perhaps planning for a romantic night or trying to calm their nerves on a date. But the iMedix sources explicitly strongly label this combination as unsafe.
It is what you might call the great alcohol paradox in this specific context. People frequently use alcohol to lower their social inhibitions or to reduce their performance anxiety, which they incorrectly believe will aid their sexual performance. However, biologically speaking, alcohol is a central nervous system depressant.
Right?
Clinically, it actively impairs sexual function. It numbs the nervous system. It dulls the brain's physical response to stimulation, making it physically much harder to achieve an erection in the first place, completely counteracting the very reason they took the pill.
And beyond just ruining the desired effect of the expensive drug they just bought, the text points out that alcohol is also chemically a vasodilator.
Exactly. Just like sildenafil, alcohol causes your blood vessels to expand and dilate. This is why people get warm and flushed when they drink. When you carelessly combine the potent vasodilatory effects of a clinical dose of sildenafil with the uncontrolled vasodilatory effects of alcohol, you massively potentiate that orthostatic hypotension we talked about earlier.
So the pressure just bottoms out.
The text explicitly lists the grim results of this combination: severe dizziness, tachycardia, which is a rapid pounding, racing heart rate, as the heart desperately tries to pump faster to compensate for the plummeting blood pressure, and syncope.
Syncope meaning fainting, literally passing out.
Yes, passing out cold because your blood pressure bottomed out and your brain didn't get enough oxygen, which is certainly not the romantic, confident outcome anyone is looking for when taking this medication.
Absolutely not. And I think this is actually a really perfect transition point for us to look at the deeply human element of all this data. We have spent a lot of time in the clinical weeds today talking about enzymes, systemic blood pressure drops, the half-lives of molecules. But the iMedix source material provided something truly incredibly invaluable, a massive comment section filled with real, unfiltered user reviews from people actually taking Kamagra.
Those are gold.
Reading through these reviews really grounds all this sterile medical data in messy, real human behavior.
It absolutely does. The medical literature can only tell us what a drug should do in a controlled clinical trial. Patient reviews tell us how it actually impacts their daily lived experience, their complex psychology, their confidence, and their most intimate relationships.
Let's actually look at a few of these specific reviews because they are fascinating to psychoanalyze. We have a user going by the name JimRat77 who simply says, Kamagra worked really fast for me and the effects were strong. No complaints here. And then another user, Zapopa Rodriguez, writes a glowing review. This medicine is without a doubt the best in the market. We are now a very happy couple. I started seeing result the first day of using this product. I am a happy customer and would like to recommend it to other people as well.
When you listen to those reviews, they really highlight the profound, undeniable positive impact that effective ED treatment can have on an individual's quality of life and their relationship satisfaction. When the medication works exactly as intended, and it works safely, the results are deeply emotionally meaningful for the patients. You can hear the palpable relief and the joy of the restoration of intimacy in those comments. It isn't just about blood flow to them. It's about repairing a relationship.
You really do hear that relief. And there's another review from a user named Desmond that perfectly echoes the hard clinical data we discussed earlier about the PDE5 enzyme. He says, this drug has indeed proven to be as effective as the description stated. Not only did it give a prolonged duration of sexual intercourse, but it also made erection as firm as a rock.
Desmond's comment is a perfect real-world translation of the physiological mechanism. The prolonged duration and the firmness he is experiencing are the direct, tangible results of those high cGMP levels relaxing the smooth muscle and maintaining that vascular dilation for a longer period. The drug is effectively blocking the PDE5 cleanup crew, allowing the natural process to sustain itself much longer than his body would normally allow.
But the reviews also offer a really vital, sophisticated medical context. There is a fascinating comment from a user named Matt Warwick. He says, "A hormone imbalance caused my ED, but taking this while getting treatment for it helped a lot."
I love that review because this is a textbook, perfect example of proper, medically supervised use of sildenafil. Matt has clearly seen a doctor. He knows the underlying etiology of his EDD. He explicitly states it's a hormone imbalance. He is currently receiving specific targeted medical treatment to correct that root cause.
Right.
But in the meantime, while he waits for his hormones to balance out, he is intelligently using sildenafil as a temporary symptomatic treatment to address the mechanical issue of blood flow. He isn't relying on Kamagra to magically cure him. He's using it as a bridge while the core medical issue is resolved. That is exactly precisely how this drug is intended to be used within a comprehensive, holistic treatment plan.
That crucial distinction between a permanent cure and a temporary symptomatic treatment is so important for people to grasp. Now, the comment section also highlights some truly fascinating, somewhat alarming misconceptions about how the brain and the body work. We have a review from a user named James Huang who excitedly says, "I like that it helps produce oxytocin." And I noticed the iMedix site administrator actually had to jump into the comments and reply to this one specifically.
Yes, the administrator had to step in and gently but firmly correct the medical misconception. James is incorrectly attributing the actual chemical production of oxytocin, which is often referred to in pop science as the love hormone or the bonding hormone, directly to the pharmacological action of the drug itself. As we have discussed at length, sildenafil is a strictly mechanical, purely vascular drug. It does not synthesize, nor does it stimulate the release of oxytocin or dopamine or serotonin or any other neurotransmitter in the brain.
It's not a mood-altering drug. It's not a psychedelic or an antidepressant.
Exactly. It has zero psychoactive properties. However, the administrator wisely points out the secondary behavioral effect. Sildenafil facilitates a purely physical, mechanical process. That physical process then allows for the act of intimacy and close sexual connection. And it is that deeply human intimacy, that physical closeness with a partner, that naturally triggers the human brain to produce and release oxytocin. The drug merely builds the bridge. The human experience of crossing that bridge together is what releases the oxytocin. It is crucial for patients like James to understand that the pill isn't creating the emotion or the bond. They are.
I love that clarification. It gives the agency back to the patient. And finally, there is a very short review from a user named Martin Robertson that brilliantly brings us right back to the dangerous regulatory Wild West we spent so much time dissecting earlier. He ignores all the medical talk and simply asks the forum, "Where do you get the jelly flavors you mentioned?"
Martin's question is the exact, perfect manifestation of the blind consumer demand for these alternative, unregulated forms we talked about. He isn't asking a doctor about his cardiovascular risk profile. He isn't asking about dosage accuracy. And he isn't asking about drug interactions. He is acting like a consumer looking for a specific flavor of candy.
Yeah.
The iMedix administrator gives a very cautious, legally sound reply, advising him to only consult reputable, licensed pharmacies. But as we know from the stark safety warnings, finding a truly reputable source for an entirely unapproved, heavily counterfeited, fruit-flavored pharmaceutical jelly on the internet is an incredibly, perhaps impossibly, risky endeavor.
It perfectly encapsulates the modern tension between the consumer's deep desire for convenience, variety, and discretion, and the harsh, unforgiving realities of global pharmaceutical regulation. Now, looking at the wider landscape of this entire topic, the sources provide some important nuance regarding alternatives and off-label facts that I think we absolutely need to cover before we wrap up.
If we connect this to the bigger picture, it is important for the listener to know that sildenafil is not the only PDE5 inhibitor on the market. The iMedix text lists several established alternatives, like tadalafil, which is widely known by the brand name Cialis, and vardenafil, which is known as Levitra. They also mention other generic sildenafil products floating around the international market, like Synforce.
Which raises an obvious question. If they all do the exact same thing, if they all inhibit PDE5, why do we need multiple competing versions of these drugs?
Because while they all target and inhibit that same PDE5 enzyme, their underlying pharmacokinetic profiles are quite different, meaning how long they last in the body and how quickly they take effect varies significantly. Tadalafil, for instance, has a dramatically longer chemical half-life in the bloodstream than sildenafil. Its physiological effects can last up to 36 hours, which has famously earned it the pop culture nickname, the weekend pill.
Ah, I've heard that.
Sildenafil, as the text carefully notes, has a much narrower, more predictable window of efficacy, usually around 4 to 6 hours. Expert physicians will choose the specific medication based on the patient's individual lifestyle, their specific response to the drug, and their unique tolerance for specific side effects.
And the text gives a very explicit, bolded warning regarding these alternatives. Under no circumstances should a patient ever mix them.
Concurrent use of multiple different PDE5 inhibitors provides absolutely zero additional clinical benefit, but it severely exponentially multiplies the risk of every single adverse reaction we have discussed. You are essentially just overdosing your entire cardiovascular system on vasodilation.
The sources also take the time to clearly define the specific populations for whom this drug is absolutely not intended under any circumstances. We mentioned it briefly earlier, but it absolutely bears repeating. It is categorically not for women, it is strictly unsafe and unapproved for children and adolescents, and it is strongly not recommended for use during pregnancy or breastfeeding. Furthermore, the text makes a very pointed statement. It is not for enhancement. It does not physically enhance sexual performance in individuals who already have normal, healthy erectile function.
That is a critical point to amplify. If a young man's vascular system and his nitric oxide cGMP pathway are already functioning perfectly normally, introducing a potent PDE5 inhibitor will not provide a magical supercharged result. It's a corrective medical tool, not a performance-enhancing recreational supplement. Using it recreationally, without any true medical need, unnecessarily exposes the user to all the severe cardiovascular and visual risks we've discussed for absolutely zero physiological gain.
There is also a completely fascinating piece of off-label medical trivia buried in the sources. We have spent this entire hour talking exclusively about ED, but sildenafil was actually approved by the FDA under a completely different brand name, a drug called Revatio, for a completely different, extremely serious medical condition.
Yes, it is used to treat a condition called pulmonary arterial hypertension, or PAH. This is a severe, life-threatening form of high blood pressure that occurs specifically in the arteries of the lungs. The biochemical logic is exactly identical. Sildenafil relaxes the smooth muscle in those specific pulmonary blood vessels, dilating them and drastically reducing the dangerous blood pressure in the lungs, which makes it much easier for the struggling heart to pump blood through them.
However, the iMedix text makes sure to forcefully clarify that Kamagra tablets, and certainly the oral jelly, are not manufactured, dosed, or medically indicated for treating PAH. You cannot substitute a legally dubious illicit ED pill for a precise, life-saving cardiovascular pulmonary medication.
Absolutely not. The precise dosing regimens, the frequency of administration, and the required medical monitoring for PAH are completely, totally different from the on-demand dosing used for ED. Relying on an unverified, entirely unregulated pill like Kamagra, with all its potential dosing inconsistencies, to manage a severe, potentially fatal condition like pulmonary arterial hypertension would be an incredibly dangerous, reckless decision.
Finally, before we finish, there is a very practical, almost domestic piece of advice buried deep in the administration notes regarding food. The text simply says the onset of action may be delayed by a high-fat meal.
This is a classic pharmacokinetic absorption issue, and it catches people off guard all the time. Sildenafil is a highly lipophilic molecule. That means it chemically loves to bind to fats. If you consume a heavy, high-fat meal, say a massive ribeye steak, French fries, and a rich, creamy dessert, right before taking the medication, the drug molecule gets physically trapped in the heavy fats sitting in your digestive tract. It takes the stomach much, much longer to break down those heavy fats and finally absorb the drug into the systemic bloodstream.
So you might be sitting there waiting an hour, 2 hours, or even more, getting frustrated and wondering why the expensive medication isn't working, simply because of the heavy dinner you just ate. The text strongly advises taking it on an empty stomach or after a very light meal for the maximum, most predictable effect. It seems like such a small, trivial detail, but it is a massively important one for the end user who is trying to precisely time the administration of the drug.
It really speaks to the vital importance of deeply understanding the specific medication you are taking. You can't just casually pop a pill and expect instant magic without understanding how it interacts with your body's basic functions like digestion.
So what does this all mean? We have covered an immense amount of ground today. We have looked deeply at the incredible, highly effective, scientifically sound molecule that is sildenafil citrate. We have seen exactly how it elegantly manipulates the body's natural enzymes to restore vital blood flow and function. We have read the real-world reviews showing the profound, undeniably positive impact this specific molecule can have on people's confidence, their happiness, and their most intimate relationships.
But we have also stared directly, unflinchingly at the dark, dangerous side of this global phenomenon. We have seen the severe, sometimes fatal medical risks of unmanaged systemic vasodilation, the sudden, terrifying drops in blood pressure, the deadly interactions with common nitrates and alcohol, the potential for permanent vision and hearing loss.
And perhaps most importantly, we have thoroughly unpacked the profound dangers of the vehicle itself. The sildenafil molecule is sound, but Kamagra, functioning as a totally unregulated gray market product, brings a massive host of quality, safety, and legal unknowns. The complete lack of FDA or EMA oversight means the consumer has zero independent guarantees. The desperate reliance on illicit, shadowy online pharmacies exposes those vulnerable consumers to the very real risk of counterfeit drugs, wildly incorrect dosages, and terrifying hidden contaminants like heavy metals.
The safest, most medically effective right is abundantly clear. The text continually emphasizes that erectile dysfunction is very often a glaring symptom of a much larger, potentially dangerous underlying health issue. The critical, non-negotiable first step is a proper, thorough medical evaluation by a doctor to uncover that root cause, be it cardiovascular, hormonal, or neurological. And if a PDE5 inhibitor is deemed the right choice, obtaining a legitimate prescription from a licensed healthcare provider and filling it at a strictly regulated, inspected pharmacy is the absolute only way to ensure a safe, verified chain of custody for the chemicals you are putting into your body.
If you are listening to this, the ultimate takeaway is incredibly simple. Your health, your safety, and your life are worth infinitely more than the brief convenience or the perceived cost savings of an unregulated, anonymous internet purchase. Be an informed, educated patient. Deeply understand the complex chemistry of what you put into your body and demand the rigorous safety guarantees that only regulated, transparent medicine provides.
I think this entire discussion raises a deeply important question to leave you with. Building on everything we've analyzed today, I want you to truly consider what it says about the current fragmented state of modern global healthcare, that millions of men worldwide willingly choose to bypass their own country's robust medical safety nets. They are actively, knowingly willing to risk heavy metal exposure, severe cardiovascular events, and completely counterfeit drugs, all just to access affordable private intimacy. What happens to public health when the fundamental, undeniable human desire for connection collides so forcefully with the strict, often financially prohibitive walls of global pharmaceutical regulation? It is a complex question that challenges not just how we regulate dangerous drugs, but how we view baseline access to essential quality-of-life healthcare.
That is a phenomenal, highly provocative thought to end on. Thank you so much for joining us on this extensive deep dive today. We truly hope it gave you a much clearer, more nuanced understanding of the elegant science, the severe risks, and the complex human realities surrounding this topic. Keep asking hard questions, stay curious, and always think critically about the information and the medications you choose to consume.